your classrooms, your studies, as we close out a week celebrating the many ways that global learning shapes our lives and our communities. So today we are pleased to welcome a friend of mine, Blanche DiDomenico, a Filipino-American nurse, certified case manager, and life coach. Blanche earned her nursing degree from Silliman University in the Philippines. I probably didn't say that right.
Yeah, you got it.
Passed her board exams there and later the NCLEX, all the nurses know what that means, in Tokyo, Japan. Her career spans a wide range of clinical areas, including but not limited to labor and delivery, oncology, hospice, and even nursing education. She now serves as a senior clinical quality nurse for a major U.S. healthcare organization. Blanche is also the author of Rise with Purpose and hosts 2 podcasts where she empowers women to navigate life's transitions and with confidence. This morning she'll share a Filipino-American's perspective on nursing in the Philippines and the United States, and explore how cultural understanding impacts patient care and professional growth. So please join me in welcoming Blanche DiDomenico.
Good morning, everyone. How's everyone doing today? Deep breath. I'm kidding. Good morning. So I was telling Heather that this is a treat for me. So I used to teach nursing a long time ago in the Philippines, and this is my pleasure truly to see nursing students and our faculty, and it's just so amazing that I am here. So thank you for having me. Today we're actually going to be talking about caring across cultures and my perspective, a Filipino-American's perspective on nursing in the Philippines and in the USA. So thank you for that introduction, Ms. Heather. I truly appreciate it. So before we do that though, I just want to, loosen us up. I know you guys are probably thinking of other things, but I want us to be here and be engaged. So please don't hesitate to ask questions, raise your hand, because this is very interactive. This is really not just about me, it's all about us. So, okay, first question. And I also have a prize. So, who can give me a Filipino phrase or word? Raise your hand if you want to answer. Yes, ma'am.
Well, I know they speak Tagalog and they like to eat balut.
Oh my goodness, balut. Okay, balut is a Filipino word. What's your name? Talia. Okay, I gotta make sure I take note because you will have one prize for me. After this, please come and see me, okay? So Talia said balut. Now, it's funny you said that because that's one of my other questions. Who knows what balut is? Yes, what's your name?
Oh, Alicia?
Alicia.
It's a duck egg. That is, it's partially, what's the word? It's like fertilized or whatever, so.
Yes, good job, Alicia. So it is a duck egg. So you can Google it, guys. Okay, it's B-A-L-U-T, balut. It's a Filipino delicacy. My husband who's been in the Philippines, he never tried it because he was scared, okay? So when you open this egg, you can see the forming chick in there, and truly it is really good, but some people just like, oh my gosh, I'm not eating like a chick, and it's weird. But it is a Filipino delicacy, so if you guys go to Philippines, try balut. So there's, what's her name again? I'm sorry. Talia and Alicia. All right, next one. Let's see. Who can guess how many islands the Philippines have? Give me a number. Yes, sir.
6.
Okay. Maybe a little bit more than that. Okay, a little bit, I would say thousands. Thousands. It's okay, we're learning. Who has a guess? Come on, it's just thousands. Philippine Islands, yes.
5,000.
What's your name? I'm sorry? Ashlyn. So Ashlyn says 5,000. Now it's a little bit higher than that. Who can?
6,000.
A little bit higher than that. What's your name? Huh? I'm sorry. Yamu? Yamu said 7,080? 7,008. Okay, I'll give it to her because, so the exact number of islands in the Philippines, 7,614 islands. Crazy, right? And I think at least 2,000 of them are not inhabited yet, so if you want to buy an island, you know where to go. Okay, so 3, all right, one more. Okay, this is kind of hard, so I don't expect you to know. But, who do you think, who is our Philippine national hero? His initials are J and R. Yes, ma'am. Okay. Any guess? All right, it's okay, no problem. So those who answered, please come see me afterwards. I have a gift for you guys, okay? So our Philippine national hero, his name is Dr. Jose Rizal. So if you Google him, he was actually killed during that time because we were under the Spanish rule for 333 years, from 1521 to 1898. He was one of the heroes because he was a journalist, he was a doctor, he was all kinds of different things, but he wrote against the Spanish regime and they killed him. So anyway, that's just a trivia for you guys. So at least you know a bunch of things now about the Philippines, right? Okay, so I'm just gonna talk a little bit about our agenda today. I'm just gonna share a little bit of my story, nursing by numbers, nursing in the Philippines, nursing in the United States, comparing the two healthcare systems, my perspective, our key takeaways, and of course, I really want us to have enough time for question and answer as well. So that's me. Okay. In nursing, in my senior year of nursing, so just an FYI, in the Philippines, we have BSN. We don't have ATM, so it's really 4-year course. But in my fourth year in nursing school, my nursing research teacher, she was our dean also. Scared. We are scared of her. Her name is Dr. Cinda. This is what she told us, all of us. She said, life is difficult. Who can resonate with that? Right? So she said, life is difficult. And just to give you a little bit of background about me, so I was born and raised in the Philippines. Don't ask for my age, please. But I came from very humble backgrounds. My mom, she was a midwife, and my dad, unfortunately, they got married early, my parents, and in the Philippines, if you don't have a college degree, it's so hard for you to find a job. And so when I was 10 months old, my dad had to leave the country and he went to Saudi Arabia to find work so that he can support his family. So I didn't really grow up with my dad. He came back when I was already 14 years old. And I have 2 younger sisters. Now, even though my mom worked as a midwife, and I was really already exposed in the hospital environment, but I know every time she would tell me, because if you work in a hospital in the Philippines, you don't get paid a lot. And she would be like, don't be a nurse, don't be a nurse, don't be a nurse, that's what she said. But something happened, just fast forward in 2000, wait, what year was that? Yeah, I was 18 in 2000. They came to the United States, both of my parents, so that they can earn more money and send money to us and back home. So I was still there, I was 18, my younger sister was 14 and then 9. So I basically raised them while still going to school as a nurse. So eventually she wanted me to become a nurse, so I ended up, and I'll tell you more about it later, about my school. But yeah, life was hard. We didn't have a lot of money. That's why my parents really had to leave the country, because there's not many jobs that can support our family. And so I became a nurse. Well, I graduated in 2005, March 2005, in one of the American schools, one of the only American schools in our country. And I'm going to tell you more about that later, but I'm very blessed to go there. It's called Silliman University. I graduated March 2005. Can't believe that's a long time ago. And I passed my NCLEX, just as my Ms. Heather said, in 2007 in Tokyo, Japan. You were probably thinking, why should I have to go there? At that time, unfortunately, there were no testing centers in the Philippines, so I had to go to other places, and I chose Tokyo, Japan. Some people went to Guam and all that, so I went there. And guys, after I took the exam, I went to my hotel because I was by myself and curled up in the fetal position and cried because it was so hard, but you know what? I passed one take, so that was amazing. And I came in the United States in 2010, got married to my husband. And I do have the diverse clinical background, so I did labor and delivery, obstetrics, med surg, hospice, palliative care and oncology. And I also did care coordination and became a certified case manager. This was when did I get certified? 2017, yes. No, I'm sorry. Yes, 2017. That's when I was 32 weeks pregnant with my youngest child when I was taking the test for the CCM. That was crazy. But yeah, we did that. And then currently, right now, I do work at home, so full-time remote, way before crazy COVID happened, right? I'm just so grateful that since 2018, I've been working at home for one of the top insurance companies in the United States. Now, currently, I am a senior clinical quality nurse. So we wear many hats, right? Why not? Why not? So I'm also a certified life coach. I'm a speaker, author, and who's social media influencers here? I just put that in there because I know how important social media is. I know sometimes people look at social media and look like, ugh. But you know what? It's a tool, and we can use it to empower and impact people. So that's why I'm there, and I'm also a podcaster. So later on, you'll know what my podcasts are. So, but enough about me. I really want to talk more about my perspective about nursing. And again, for all nursing students out here, my goal today is, even if the one takeaway is really to let you know that nursing is an amazing thing. It's more than a profession. It really is a calling. Okay, nursing by the numbers. This is crazy, right? Look at that. This is the Philippines statistics. So there's 951,105 registered nurses in the Philippines. That's a lot. That's a lot. I don't know the statistics here in the United States, but we produce a lot of nurses. And when we talk about history later on, I'll let you know why. And here in the United States, okay, before I go, who's from other states here? Like not just from North Carolina? Okay, cool. So if you've been to hospitals, have you seen a nurse that's Filipino? Okay, thank you. There's a running joke, right? I don't know if you've seen him. His name is Nurse John. Yes. Fine. Oh, everybody knows Nurse John. Oh my gosh, I love him. I love him. So that's a running joke. If you're Filipino, guess what? You gotta be a nurse. But anyway, here in the United States, Filipinos make up of 4% of all US RNs. And it is one of the largest groups of foreign-born nurses. And this is crazy. I think there's more, but it says over 150,000 nurses have migrated since the 1960s. Well, in California alone, there's 18% of nurses that are Filipinos. In 2024, 28,258 Filipino graduates took NCLEX RN exam. So, like in my batch, so we graduated 2005, right? Almost, I would say, more than half of our class, the moment we took our Philippine nursing exam, maybe a few months after, almost half of our class took the NCLEX RN exam. And nursing or healthcare industry really is one of the top healthcare sectors in the United States. Not just nurses, of course, there's our physical therapists, OT, speech therapists, and also RTs or respiratory therapists. So let's go with a little bit of history. So in 1903, as you can see there, it's called the Pensionado Act. This is a U.S. program funded for Filipino students, including women in nursing, to study in the United States. Many were trained in American nursing schools and then returned to the Philippines to teach. Remember I said earlier there's like 300 something, or there's so many nurses in the Philippines. Well, one of the biggest things is because of this Pensionado Act. And I don't know, do you know that the Philippines were also under the American rule? Did you know that? Okay, so after we were under the Spanish rule from 1521 to 1898, and there was the Filipino-Spanish War. Of course, we lost. We went against the Spanish. So what happened was the Spanish government sold our country to the United States. I forgot how much, but they sold our country to the United States. So we were under the United States rule from 1898 to 1946. Now, crazy, when was our Liberation Day? It's the same as yours, July 4th. So we celebrate our Independence Day, July 4th, 1946. But this explains why during this in 1903 that there were so many nurses who came to the United States and were trained here and then went back and they established schools based on American education. And then in 1907, as you can see, there's a first wave of nurses that came. They really became an integral part of the exchange between U.S. colonial government, the Philippines, and American hospitals. And most of these nurses were recruited and they went to major cities like New York and Chicago. Just a little bit of background, there's so many Filipino families in Chicago. One of my families there. Chicago, New York, and California. But truly, I think most of the diaspora with nurses were in New York and Chicago. So now, remember I said after 1946, we were fully liberated from the United States, but I think most of you guys understand that, you know, Filipinos do speak English. When we are taught English since kindergarten. So, because we were under the American rule, and I believe that's such a blessing for us because I think the Philippines is one of the best English-speaking people in the whole Southeast Asia. So after World War II, what happened? There were more Filipinos recruited with programs called Exchange Visitor Program, which aimed to bring in foreign professionals temporarily. And then in the 1960s and the 1980s, there's this major migration boom with US, well, at that time, there was US nursing shortages, and the Philippines' strong nursing education system, again, modeled from the American system, where Filipino nurses are very equipped and confident to migrate and really give care to the United States population because we are trained the way you guys are trained. So in 1970s, 1980s, the Filipino foreign trained nursing group in the US is one of the largest. Okay, so here's some important facts and key facts in the Philippines. So I was just saying earlier, we don't have ADN. All nursing programs are BSN, so it's 4 years. It's all bachelor's science in nursing. And the BSN curriculum, just like yours, is competency-based, evidence-based, but it's very community-oriented and value-based. We have what we call the PRC, or the Philippines or Professional Regulations Commission. So just like you guys, once you graduate, you will take your board exam, right? We also have to take our board exam, and they regulate the nursing practice in the Philippines. And this is the most recent that I can find. July 2021, there are 333 nursing schools in the country. And I don't know exactly how much students are being produced every year, but we do have an abundance of nursing in the country. And one thing, that's a good thing, but on the other hand, during my time especially, so I started nursing 2001, and I graduated 2005. During that time, there was this big nursing boom, and when we graduated, it was so hard to find a job because guess what? There were so many of us nurses, and there was not enough hospitals to accommodate us. Now, I want to ask you guys, so you're here, who are our first year nursing students? Can you raise your hand? Yay, freshmen. Okay, what about our second year nursing students? Awesome. And is there a BSN curriculum here? I'm not sure. Okay, so it's ADN. So there, when we graduated, again during that time, it was like, oh my gosh, what are we gonna do? So like me, to be honest, I didn't become a nurse right away. I work, we call it BPO, I work for AT&T. I answered phone calls. And also in the Philippines during that time, and I think it's the same right now, we had to work voluntarily so we can have nursing experience, so we can go to other countries to work. Because if you go, like for example, if you want to be hired in the United States, but you have no working experience, you will not get hired, right? So I worked for a year voluntarily in a public hospital with no pay. That crazy? But I think here in the United States, if you're a nurse, you will always have a job. Okay, I'm gonna boast a little bit about my school. This is called Silliman University. It's in the central part of the country, so if you can Google it later on, not right now, it's in the central part of country. It's called Dumaguete City, Philippines. City of the Gentle People, they call it. And Silliman University, I'm very proud to say that their nursing program is one of the best. There's 5 Center of Nursing Excellence in the country, and we're one of the 5. And why is it called Silliman University? I'm gonna give you a quick story about this. The founder, actually he's not really the founder, he was he was a New York philanthropist. His name is Dr. Horace B. Silliman. He was from New York, he had a lot of money, and he really wanted to help the Presbyterian Church and really send missionaries. So in 1901, he gave, I think, $10,000. I can't remember if that's correct, but he gave a lump sum of money to the Presbyterian Church to help missionaries start a school in the Philippines. And that's when they started Silliman Institute at that time. So that's 1901. The first students were 12 boys and 3 girls. Can you imagine? And now it's one of the biggest universities in the whole entire country and even in Asia. So we're grateful every time I say Silliman University. There's already that connection with the United States. Okay, a picture on the top right or left of you. There's one of me there. I don't know if you can see me, but I'm there. So that's me during my nursing days as a nurse clinical instructor. All of us wearing pink are the nursing instructors, and the ones wearing white are our nursing students. I taught second year and third year nursing. So why were we just wearing t-shirts and jeans? Well, this is our community outreach program. And we go to communities and we actually taught our community people, because here's one thing about the Philippines, and it's different here. In the Philippines, not many have insurance, okay? Not many have insurance. So one thing about the Philippines is that we all really integrate holistic nursing. And with regards to community nursing, we go and visit house to house. And we also, we visit house to house and we teach our community people on how to help themselves, how to take the vital signs, and also how to make their own herbal medications. Isn't that cool? So in the Philippines, it's a tropical country, right? So I remember we would be picking herbal plants around the community, and we will teach our community people how to make their own cough syrup, how to make your own antipyretics or put your fever down, or how to make your own ointment. It's really cool. Because here's the thing, not many people can afford medications. And that's me again. So the school that I taught is called Negros Oriental State University, and that's our nursing, that's my nursing group right there. So I just wanted to share my experiences during that time. Education and training, it really is the same, kind of. It is the same. Again, it is 4-year degree, but it is the same because all of our textbooks, all of our curriculum is really based in American education system. However, just like I said, we integrate holistic nursing, we integrate herbal medications also in the country, which is, I know it's different here, but in the country they published at least 10 medicinal plants that are that are really helpful for people to use for, like, let's say just bellyache or something wrong with your teeth or whatever. So we are teaching our community this. And community centric, just like I said, and of course we have theory and clinicals. Who's doing clinicals already? All of you guys. Oh, what clinicals are you in right now?
Really
Med surge? Oh, great. Do you also go to community? Is it part of curriculum?
We have the health department.
Oh, okay. Gotcha. All right, so that's kind of different. So for us, we have one whole year of community nursing. So there's a lot of education, like family planning, education with hygiene. As you can, I don't know if you've seen the news, like recently there's this big typhoon that went through the Philippines, and their houses there, especially the impoverished people, their houses are, some of them don't have floors in them. So these little kids would be running around with no slippers or flip-flops, and then they would just run around, and then they would either have a cut on their feet, or then they would have all kinds of bacterial infections, you know what I mean? And when I work in the hospital in med-surg, it broke my heart. Why? So it's different. I don't know now. Again, this is 15 years ago. I remember in the Philippines when we were taking care of our patients. So how here in the United States, right? You go to hospital, let's say you went there for high blood pressure. Your medications come from your pharmacy, correct? And the nurses dispense through the pharmacy will give you your medication. Well, in the Philippines, what happens is that if, for example, if you are given, you need antibiotics. So what they do, they have a prescription from the doctor, and they give that prescription to the family. So let's say Miss Smith has infection. That prescription they'll give to their family, and the family needs to go outside the hospital and get those medications. Now you gotta understand, again, there's not many who have insurance, so everything is out of pocket. So I remember this was such a hard reality for me when I started working in the hospital. I would go on my rounds, and each room we have a little box for the patient's room, right? So let's say Mrs. Smith, and I'm supposed to give, let's say amoxicillin, just an example. But then I look at her box, and there's no amoxicillin in there. What do? I go in her chart, and I put no medication. And I just move on. That's reality. Isn't that sad? Can you imagine you're not able to get medication for your sick parent or your child because you have no money? Some people would sell their cows or get money or loan just to get medication. It's so hard to get sick in the Philippines. It's really, really sad, even up to this day. So those are one of the hardships I went through, because again, you're a nurse, you wanted to help your patient, but what can you do? I mean, sometimes this happened. We're not supposed to do this, but I forgot what it was. There was this lady, oh my gosh, she had no family, and she had a trach, and we don't even know who her family was, and she had a trach, and we just keep giving her fluids, give her, the few tube feedings, and then she ran out of tube feedings. She ran out of trach care materials to even just clean her trach. So what we did with my coworkers, we chipped in, or we got some money just to buy her own tube feedings and just to clean her trach, things like that. I know it's different here. We have an abundance of supplies. You go to the supply room, we have a supply, but it's different there. And also, I remember when I was a nurse, so we had to count the drips of our IVs. Who has done that? Nobody. Oh, yay! Okay, yeah, they're like, oh yeah, I remember that. So we always have our watch. Okay, you cannot be a nurse without a watch, because guess what? You're counting those drips. And imagine giving KCL to your patients with no IV pumps. That's crazy. I don't even know how I did it. But eventually we started getting IV pumps, but very limited. And we as nurses had to fight like, oh, this is my IV pump, you know? But yeah, I had to go through that. So there's lack of resources in the Philippines. I'm gonna share you a very funny story, okay? Hopefully everybody's awake. So remember I told you about community nursing. So we go from house to house doing, again, education for our families, right? And as you can see in that picture, we're just wearing a t-shirt. We are told we have to bring an umbrella. Do you know why? Who knows why? Rain or shine? That's good, yeah. I don't know about you guys, but we don't like being in the sun, okay? You cannot find a Filipino doing sunbathing, because that's not that. But that's not just the reason. So in the Philippines, and my husband can attest to that because he went there last year, there's so many stray dogs, and I know that breaks your heart, but that's just reality. There's so many stray dogs. So if you go to a community and God forbid, there's a rabid stray dog coming at you, what are you gonna do? You gotta use your umbrella. But no, that's a true story. We are told to bring our umbrella and make sure you don't get bitten by stray dogs, okay? And so we do have theory and clinicals. And again, the work environment, oh my gosh, there's a very high patient ratio. Remember I told you before that before I could work and get paid, I had to volunteer in one of the public hospitals, and I did. And this time it was obstetrics, labor, and delivery. So at that time I was assigned to a postpartum ward. So all these women just had babies, right? Guess how many patients I had? By myself, I had 50 patients. By myself, taking care of postpartum patients. Can you imagine? I don't even know how I can imagine that right now. But remember I said earlier that in the Philippines, it is so common, because we're community-centric, right? We're also very family-oriented. So that might blow your mind with all that nursing ratio I gave you. But in the Philippines, it's so expected that if you go to the hospital, you always have a family member with you. So why is that important for us? Because let's face it, especially for postpartum women, you gotta watch out the bleeding, right? Like, they can't be just bleeding out. So we have our family member who can help us watch, like, ma'am, can you check the pad? Or like stuff like that. Or even in med search, like, ma'am, can you make sure, you know, Mr. Smith is not, you know, I don't know, have a fever or whatever. Our families become our allies. So they always have a family in the bedside. It's very rare. That's why that lady that I was talking to you about that had a trach, was very rare for them to not have a family. But yeah, 50. And then, remember I said most people don't have insurance? Well, this time I was working in a public hospital. Okay, this is gonna sound silly to you guys. So have you seen a vial of antibiotics, right? You've seen a vial? Well, here, most of the time, it's pre-mixed, right? It's pre-mixed, all you gotta is hang that bag, right? It's good. There, we have to mix our own vial of antibiotics, and that antibiotic will need to be shared by 5 to 10 patients. Okay? So and we recycle, not just recycle, but we recycle our gloves. So when you're done with your gloves here, it's like, throw in the trash. No, we have to put that in a place where they can, called autoclaving, to get it re-sterilized. I don't know, that was 15 years ago, maybe in some of the other hospitals in the Philippines now, maybe they're not doing that. But during my time, yes, we had to do that. And if you're in an isolation room, I love it here, right? You have your isolation gowns, and you can go in and you come out and you take it off, right? There, you can't do that. Everything needs to be recycled and re-sterilized. So, be grateful for your supplies, guys. What else? So again, teamwork in the hospital when you have so many patients and very little staff. The staff really becomes so close because you gotta help each other, right? You gotta help each other. You cannot just yeah, you gotta, well, here it's the same too, but especially if you have that amount of patients and limited resources. Any questions so far? Am I going too fast? I hope you're not sleeping. I'm kidding. So anyway, I was telling you guys about, we teach them how to make their own herbal medications. We do a lot of teachings in the community. Now, let's go to nursing in the United States. Oh, before I forget, you can look at the picture. So, did you do IV insertions yet? And did you practice with your yes, how'd that go? Great. And who did you practice it with? The dummy, right? What do you call your dummy? I know there's whatever the name is. So in that picture, right, you have your John Smith, Joe, whatever, Jane Doe dummy. During my time, we had no dummy. Guess what? We inserted IVs to each other. That was hard, but that means that we had to learn, like, okay, do you have good veins? All right, here you go. Poke me 5 times. That was our practice, you guys. So, yeah, that was crazy. And I remember one of my classmates who was so scared of needles. You know what she did during practicals? She took her 10-year-old son to be the one to be inserted with an IV. True story. I'm not lying. I can't lie. Yeah, it was so funny. It was hilarious. But yeah, be grateful for your dummy. So let's talk about nursing in the United States. So of course, you have your clinical instructors. And by the way, shout out to our clinical instructors. Who can you raise your hand for me? Yeah. Kudos to you, and seriously, I cannot thank my clinical instructors enough, because I'm proud to say they drilled everything in me, not just skills, not just knowledge, but wisdom in how to live our lives, right? Again, I said earlier, nursing, they think it's a profession. It's not. It really is a calling, right? Because yes, it pays well here in the United States, but it takes more than the payment for you to continue with your calling as a nurse. So, and thank you to our instructors. Awesome. And okay, so here, you probably know, in the United States, guess what? Insurance driven, right? And I know some don't have insurance, but majority have insurance in the United States. It's highly regulated. And the role of nurses here, there's so much autonomy. Of course, evidence-based practice, well, it's the same there too, but here it's really evidence-based practice. The work environment, as what I was saying, right? We have so much resources. I'm so grateful for that. And very tech-driven. However, which is crazy to me because I'll tell you about it later, but even though with all the tech that we have, with all the resources that we have, we are still stressed and we get burned out. And another thing with here in the United States, right, we are so culturally diverse, and I'm sure it's part of your curriculum, right? You will learn how to take care of patients with different cultures because there's nuances in them. So I'll tell you more about that in my experience. But yeah, we serve so many different cultures in this country. So we have some challenges. Again, Nurse John says this all the time, right? We have staffing shortages, right? Like, why did they take my CNA? Like, it's crazy. Like, why are they hiring less nurses? Like, more paperwork, Those are reality in the healthcare system here. And this one, legal and ethical responsibilities. I remember when I first started working here, it was in 2011, that they said, make sure you do this, you dot your line, or else they're gonna sue you. I'm like, what do you mean they're gonna sue me? I mean, that's unheard of in my country, but here you're gonna be careful about everything, right? And now with the technology, everybody's pointing the phone in your face. Like, I'm sorry, that's crazy to me. But yeah, that will be, that's some of our, sorry, that's one of our, here, our challenges, right? Who else can cite some of the challenges in the healthcare system nowadays? Please raise your hand if you want to answer. You might have a family member or in the hospital or no challenges? Everything's perfect? Yes. Supplies, okay, we still have some challenges with supplies. What else? Yes. Working equipment, even if you have equipment, I remember that it might not even work. It's like, yes.
I have a child that has some mental health issues, and sometimes they get stereotyped as one type of patient instead of not as a whole. It's frustrating.
It is, right. So she's saying that, you know, instead of looking at your child as a whole, they just look at maybe just the symptoms or this and that. So yeah, I was trained, this is drilled in us. When you look at your patient, you look beyond the symptoms. You have to see the patient as a whole, holistically, body, mind, and spirit. And I also wanted to stress a little bit, because I didn't talk about this. In the Philippines, and I know it's different here, so in the Philippines, 85% are Christians or Catholics, and our faith is really integral in our practice. So there, we pray with our patients without needing to ask, because it's really part, and faith has a big pivotal role when we take care of our patients. So I know I was told here when I first came in, you know, it's not like that, but I believe that, you know, having that belief really helps, especially with the healing of our patients. Again, that's part of the holistic care that you give to your patients. Okay, so this is kind of busy, but just bear with me. So we're gonna be comparing two of the systems that we just talked about. So I was just saying, in education in the Philippines, we only have 4 degrees. And here we have ADN, you can go to BSN, MSN, and DNP. Licensure is the same, we have to take a board exam. I personally feel like NCLEX was so hard compared to our board exam, but our board exam had different other, I would say, focus compared to NCLEX. And work environment, I was just saying, high patient ratios, very limited resources in the Philippines. We do rely a lot on family and teamwork. Here, there is, in a way, better staffing ratios, advanced technologies and resources. However, there's still stress because of the high demand of the family, maybe, or even the work environment. And the role of nurses, I think it's both, more task-oriented, physician-directed. There's a lot of respect, especially with seniority. Seniority is huge. I don't know if you've seen Nurse John in one of his skits, but he always says this tita nurse, right? So this tita nurse, she's kind of like the undesignated leader of the pack, and you have to always go to her. It's kind of like that. We always have this respect for especially our elderly or older nurses, and we always ask them for advice. I think it's the same here too. But here there's really greater autonomy. We have an interdisciplinary team, which I absolutely love. And of course we have advanced roles that are available for us. Now, cultural values, I'm just gonna read this. Pakikisama, what is pakikisama? It's really harmony. So most of us Filipinos, I'm just gonna speak for myself, we're non-confrontational people. We just wanna, you know, share our food, feed you lumpia and pancit. You know, we just want camaraderie and family and, you know, just helping each other. Malasakit, what does that mean? It's compassion, and again, I was just saying family-centered and faith-centered. Those are very huge values in the Philippines. Here, there's patient-centered autonomy. You know, our patients can absolutely say no to treatments. Of course, there you can also, but here they can say no to treatments. Informed consent, which is the same for there also, but privacy is emphasized. Here is huge. Privacy is huge, and we have, like for me, I had to learn this really when I got here, because in the Philippines, if you go to a ward, we call it ward in the hospital, there might be 50 people in one ward, and there's no privacy. Okay, but people don't care. It's fine, you know? But here it's huge. Like, you better think of the privacy of your patient. HIPAA, of course, right? HIPAA is drilled to us. HIPAA. Don't use your phone, like taking pictures of, you know, even if you're doing TikTok dances, please don't do TikTok dances when you're working. But you know what I mean. Privacy, HIPAA, and all that, especially in the digital age. And work culture, hierarchy is huge in the Philippines. Again, I was just saying, seniority is huge. Always having that respect for our elder nurses, and collectivist approach, meaning we come together. I think it's the same here also. You know, people come together. It is very collaborative because we have IDTs or interdisciplinary teams. We have our social worker, our case manager, right? We work together with our RTs, our physical therapists, and all that. So it's collaborative. We have to be assertive here. I have to learn that, and I'll tell you later why. And individual accountability. And then employment context. So here's the thing. In the Philippines, we call it brain drain. What does that mean? Most of our nurses leave the country. Why? Can you imagine being paid $200 a month? That was my salary when I worked. That was 2008. So it's, I don't know why. I hope they change it. Nurses are one of the lowest paid professions in the Philippines. And no wonder they leave, right? They leave. So that's why you've seen earlier the numbers that so many nurses leave. So most of us go to nursing thinking of, you know what, I'm gonna work somewhere else in abroad. And again, we're an oversupply of us, graduates. Here, we have really strong job demands. I mean, you can work in a hospital, you can work in a nursing home, you can work in rehab, you can work in the office, physician's office, like me, you can work at home. Like, there's just so much avenues for nursing. It's just so amazing the opportunities we have here. And competitive salaries and benefits. Now again, challenges in the Philippines, I was talking about that, local pay, uneven school quality, and maybe domestic shortages. And here, burnout is real, staffing shortages, high legal and ethical responsibility, and the stress of the demand of the job. Okay, so I'm just gonna pull this all up here. So what is my perspective? Because I've been in both, right? I came here in 2010, but I started working in 2011. And I'm not gonna lie, you guys, culture shock was real. I had a hard time. It wasn't about the patient care, because caring goes across culture, right? We all have a heart to care for our patients, but what I really struggled about was the cultural nuances. Like, even now, I'm kind of catching myself, like, did I say the word right? You know, but also, I was saying earlier, I personally am not a confrontational people. And when you work along other nurses that are also in high stress, right? Sometimes they would do something that's so out of the ordinary. One time, there was the first time that one of the nurses confronted me because I didn't take her phone call or something. I can't remember this, and I was pregnant at the time. And she was so mad at me, and I was like, oh my gosh, like, you know, I've never experienced that ever. So that was hard. That was hard for me. Adjustments, not just adjusting with different medications. Our medications are different there than here. Maybe it's called different, right? Adjusting with, again, technology. I had to know how to use an IV pump, you know? Now I have an IV pump. Again, dealing with different cultures, dealing with different, I would say, attitudes and values in the workplace. That was hard for me. And one thing's for sure, I'm grateful is that, remember I said earlier that my dean said life is difficult. But it didn't stop there. Why did she say that? Because she wants to equip us to say, hey, when you go to this profession, you need to have a mindset of a no give up mindset. Why am I saying that? Because if by now you are in first year or second year nursing And the moment you go to clinicals, or even once you go into the world and go into the nursing and the workplace, guess what? It's gonna be difficult, right? But it all starts in your mind, truly. It all starts in your mind. I'm a certified life coach also, so I'm gonna give you some coaching skills. It all starts in your mind. You can have a fixed mindset or a growth mindset. What does that mean? Fixed mindset is all about, I can't do this, I wasn't born with it, I don't have that talent. You know, all those lies that sometimes we hear from other people or even internally. We say to ourselves, oh, I've never done that, I can't do that. The I can't attitude. And guess what? We all have that, right? But we can shift it. We can shift, and that's what I did. We can shift our mindset to growth. What does growth mean? It means there's a space for us to grow. So I taught this to my children also. For example, if you say, I can't insert this IV, you stop there. Now, how do you change your mindset? You're gonna say, I can't insert this IV yet. Putting the word yet changes everything. For example, you'd be like, I don't know how to sing. Well, guess what? You can say, I don't know how to sing yet. Or maybe you'll be, I can't cook spaghetti. I'm just saying, it could be anything. You just say, I can't cook spaghetti yet. Yet always makes room for improvement. So you have a choice. We all have a choice. We all have a choice. Do I get stuck in this mindset like, oh my gosh, poor me, I can't do this, oh my gosh. No, it's okay. You can validate those feelings, but you don't need to be stuck in that situation. You can say, you know what? I'm going to change my mindset. And that's what I did. My husband knows this because I remember driving home from work, crying behind the wheel. I was having panic attacks. I was having so much trouble because it was such a huge adjustment to me. There were doctors who were mean to me. There were doctors like, I forgive them. But, you know, it was hard. It was hard. And remember I said earlier that assertiveness is huge in this society. I had to learn how to be assertive. I had to learn how to speak my voice. And I'm so grateful I found my voice. And that's why I'm here. Isn't that cool? So from that person who was driving home crying behind the wheel at 3 a.m, now I'm here speaking to you lovely people. Blows my mind. So I go back to being adaptable, compassion, having that work ethic, and resilience. Remember that word. What is resilience anyhow? Can someone say, tell me what resilience is? Yes, ma'am.
The ability to bounce back after you face challenges.
I love that. The ability to bounce back after you undergo challenges, right? That's a great definition. Now, I want you to picture a bamboo. Who has seen a bamboo, right? So remember this bamboo. Bamboos are wild in the Philippines. Why am I saying this? With bamboo, especially in the Philippines, we get at least 20 typhoons or hurricanes in a year, okay? With a bamboo, you know what happens during typhoon? It sways. Does it break? It could be 160 miles an hour, it doesn't matter. It's very unlikely for a bamboo to break. Do you know why? Because it sways. So when you think about, I need to be resilient, just bend. Just bend, just like the bamboo. Remember that. Just like a bamboo, I can be resilient. And I was talking about before, challenges, discrimination. I don't want to talk about this, but there was discrimination. You know, when people look at you and like, are you capable? Are you capable of doing this? But there's just a funny story one time. This lady, she was like, are you my nurse? I said, yes, ma'am, I'm your nurse. And I introduced myself. She's like, did you graduate high school? I said, yes, or I won't be your nurse if I didn't graduate high school. I mean, I didn't take offense of it, but you know what I mean. There's just things like that happens, but it's up to you how you will respond. Do you want to take offense, or are you just going to let it go, right? Now, for me, the navigation of high-tech methods and cultural differences, I'm not going to lie, not the highest, but the most challenging part for me was really knowing how to use equipment properly. because I didn't have that training. I could take care of my patients in all kinds of ways, but navigating those high-tech equipment, that was hard for me. And what are the lessons that I've learned? Be authentic. Be who you are. You don't need to pretend. If you don't know, please raise your hand. Ask questions. It doesn't matter. I don't care what the question is. I used to teach nursing, and I always tell my students, if you don't ask questions, that's dangerous. Because for somebody, I mean, again, we're learning every day. I'm still learning. You know, we always learn, but especially if you're a student, always ask questions. And number two, if I can give another one, be proactive. You know, I don't know how you feel about this, but when you go to hospitals and some nurses would look at you like, oh, there's these nursing students. When I had nursing students in my hospital, I'm like, yes, thank you. Because you know why? I see you guys as you're there to learn, and I always find my nursing students say, hey, do you want to insert a catheter? Do you want to insert this? Because that's where you learn, and this is the safe space for you to learn and maybe even make a mistake, right? I mean, you have your clinical instructors to be there with you, but please, be proactive. Find nurses like, hey man, what do you have anything for me? Do you need me to insert this IV? Whatever. Just be proactive. Go after it. If this is really what you want, you need to go after it. And integrity. That's huge, right? Not just honesty, but integrity. Even when nobody's looking, you gotta do the right thing. And if you see somebody not doing the right thing, you gotta say something. Right? You still gotta say something. And I always say, like, it's not what you say, it's how you say it, right? So many times, like, we hear the tone of the voice of that person or this person, and you'll be like, oh, but no, you can say the right thing with the right tone of voice. And I learned also that I can be myself. You know, I can assimilate to the American culture. Of course, I married an American. Oh, believe me, guys, there are times I wanted to just speak Bisaya, which is my language or dialect, and I can't. It's so hard. So, but my point is, I assimilated. I love the American culture. Number one is your punctuality. Oh, I love it so much. Because there's a running joke in the Philippines, and I'm not one of them, but they call it Filipino time, that being late is okay, you know? But Heather knows, I came here 30 minutes early. You know, I'm always early, so I love the American punctuality. Yes, we're all punctual, we're on time. I love that. So again, I was able to embrace my heritage, my values. I have 3 boys. We are raising them to embrace their American values and also their Filipino values. And I'm so grateful they were able to go home to my country last year, and they were able to see where I grew up, where I went to school. They met my classmates. They were able to eat all the foods except the balut one though. They were like, I'm drawing the line, mommy. I am not eating that. But there's another food that I wanted them to try, but they still said no. Have you heard of dinuguan? Dinuguan is pig's blood. They cook it and put all kinds of stuff in it. It's good, but I know it's not for everyone. They said, no, I'm not eating that, I'm not eating this. But all the rest, all foods are amazing. So hopefully one day, you guys can go to my country. I would love that so much. And here is the amazing thing about being a nurse in the United States. Just like me, my goodness. I'm just grateful. I'm just grateful with my journey from coming from a poor family to being here and talking to you. I mean, seriously, we all have that opportunity. And the beautiful thing about nursing is it's just your, what do you call that, launching pad. It's just your launching pad. You know, of course, you're gonna work in a hospital or just establish your skills, your nursing skills. I always call it SKA, skills, knowledge, and attitude. Don't forget the attitude. You could have all the skills. You could have all the knowledge, but if you don't have the right attitude, I'm sorry, it's hard. And you need to have the SKA, if you can remember that. Skills, knowledge, and attitude. So yeah, again, we have so much opportunities to grow as a nurse. You can start here and then you can end up here. It's like just amazing. Just grab those opportunities and never, ever, ever, ever give up, okay? And one thing's for sure, I love seeing your faces because why are you here? You wanted to care for people, right? You wanted to help. You wanted to serve. One thing, if I can say, is that nurses have servant hearts. It's all about other people. You need to have a servant heart. If you want to be a leader, be a servant. Okay. So, anybody has questions for me? Key takeaways, how about that? I would love to have your feedback, any takeaways that you've learned from this presentation. Yes?
I love that even though you came from another country, it really shows that nurses, just the care that you guys all have for, everybody, no matter where you are, what they came from or anything. So I love that takeaway from the presentation.
Thank you. What's your name?
Sophia.
Sophia, I appreciate that. Thank you so much. Anybody else? Yes, ma'am.
I want to say that as a nurse in New York, I had the opportunity to work with a lot of Filipino colleagues, and I want to say they were the most joyful group of people. There's a true joy and warmth that emanates from them that's contagious, and I could see where that cultural disconnect, because, especially many New Yorkers are not so warm and fuzzy, so that was a very welcome and refreshing, thing in my career.
Thank you. Thank you. I appreciate that. And I have so many neighbors who are from New York, and I go knock on their door and give them cookies, and now we're friends. Yay! My husband knows what I'm talking about. Thank you. Appreciate that. Anything else? Yes. Yeah, Yamu?
I'm from Africa, but when I hear you talk, I hear my life,
Oh.
how I can relate it to you, and how we appreciate what we have, because you always say thank you. You have the other side, and thank you that you have that opportunity. And it was like I hear myself talking about my country, and thank you for coming to let people know what we go through or how we live.
Thank you. Thank you so much. I appreciate that. Yes? You were raising your hand? Oh, okay. Yes.
I think it was a good reminder to appreciate the technology that we do have here in the U.S.
Mhm.
Because it is different, and we do have a lot of opportunities. So it was a good reminder for us just to be positive when we're going to work, and we have all those advantages.
Yes, absolutely. I always say gratitude always changes our attitude. Don't you think? Yes. Yes, ma'am.
I love the community nursing y'all did for the people who can't really just go to the hospital. I love that y'all taught home remedies that you could do to help yourself, whether either you can't travel or you just can't afford to go to the hospital at all.
Right. Yeah, that's one of my favorite things about when I was teaching nursing. Really just being with the community. It was fun. And then, before I forget this, because it just flashed back in my mind. So we would be going to communities, and because the community people were so grateful, we're taking their vital signs, helping them with this and that. You know what? Because we have a medicine bag we carry with us, it would be full of bananas, fish, squid, anything, because they give it back to you. It's just so funny. I would tell my teacher, guess what? I have squid today, because they wanted to share that appreciation. That's one thing I miss and love about that, because they're really appreciative, no matter how you help them. And it's the same here. We have our neighbors. You don't have to go far, right? Just go talk to your neighbor. One thing I told my husband before was that when I first came here, I was wondering, I was like, where's everybody at? Where's everybody? I'm like, where's people? Because in the Philippines, you will see all kinds of people outside playing, talking. Of course, we have no winter, right? So there's flip-flops all day. But I miss that. And it doesn't matter because we have a heart for others. Knock on your neighbor's door. Seriously, we live in a new development. My neighbor here. When we first moved there, I had nobody. We moved from Chicago to North Carolina, and we had nobody. And I told my husband, you know what? I'm just gonna cook cookies, bake cookies. And I knock on 5 doors. Nobody. I don't even know who these people are. And those 5 doors that I knocked on that first week we were there are all my friends now. See how cool that is? We just have to move out of our comfort zone. It doesn't matter, right? This is the beautiful thing about just us being human, right? Let's just go out there in the world. We don't need to be isolated, right? And if you're in nursing profession, isolation is a killer. Remember that, guys. Isolation is a killer. You do not want to do this alone. You need to have a support system because, again, it's not easy. But always have somebody or a community or band of nurses. It doesn't matter, right? You need to do life together. Okay? Anything else? All right. Maraming salamat po. What does that mean? Thank you very much. And that's my family. So the oldest, his name is Enzo. He's 13. The second one is Aiden. He's 9. And Blaze, my baby, the youngest, is 8. And you can connect with me. I told you I'm in social media all day. So I have a website, it's BlancheDiDomenico.com for my coaching business. You can check me out on Facebook, Instagram. I have a YouTube channel, Blessings with Blanche. And I have 2 podcasts, not 1 but 2. Rice Tayo, if you know any Filipino friend, whatever, please show them Rice Tayo. Rice Tayo, I started this podcast to give a voice for Filipino-Americans. Okay, so I talk about our experiences, so that we can connect, because all of us have different experiences, but we have that common denominator of, we came here, we had a lot of challenges. So it's in Spotify, it's an Apple podcast and all the, but really Spotify and Apple. So Rice Tayo. The other one is The Anointed Life with Coach Blanche. Again, it's available on Spotify and Apple Podcasts. And I do have a book called Rise with Purpose. It really talks about our identity. And you can check it out in an Amazon. And who are those 3 who I said earlier? 1, 2, there's 1 more. Is it Young? Yeah, feel free to come because I'm giving you a copy of my book. No, thank you guys so much.
All right, while Blanche is signing